Hello and welcome to the 100X Entrepreneur Podcast. And today I am super excited to be talking to Callie Turk, who is the co-founder and CEO of FlexCare Infusion Centers. So Callie, thanks so much for joining us. Welcome.
Thank you so much for having me. I appreciate it.
And just a little background to get started, Callie, before I ask my questions. So FlexCare Infusion Centers was co-founded with Aaron Smith and Callie Turk in Oklahoma City in the 2018-2019 timeframe. And the mission was and is to provide accessible, convenient, and comfortable ambulatory infusion therapy to patients who had complex chronic diseases and needed this type of therapy. And Callie, when I first heard the story of FlexCare Infusions, I was so amazed that it had grown 100x, and that's certainly a testimony to the need that you and Aaron had identified and the lack of this kind of care. So let's get everyone on the same page to get started. I'd like to just ask you to talk us through your journey to becoming the co-founder of FlexCare Infusion and any other background. You're the professional, healthcare professional. So tell us in your words what it is and why it was so needed, please.
Sounds good. Well, I am a nurse by background, and prior to starting FlexCare, I was in the home infusion space for specialty infusion. And throughout my time as an infusion nurse in the home, I did and specialized in nursing education, national training programs, and went internally to help build compliance programs and run accreditation programs for specialty pharmacies for home infusion. And it's at that point in time I realized that I'm not a normal nurse. I am a good bedside nurse, but I'm a better an operational nurse, I will say. And I think my passion is to be able to guide and implement processes and provide education to help support the clinicians in the home, which I think has been a gap in healthcare. I feel like a lot of the operational directors that I had in my past were not clinical, and they had no idea of what impact they were making to the people at the level of the patient. And so I ended up building an outcomes program I guess it was my last role prior to starting FlexCare. And that's actually where I met Aaron. And we realized that with my operational and clinical expertise and his tech background, because he had started and sold a technology company prior to starting where we ended up at, we identified that there was a huge gap that both he and I could partner together with and fix, and we could do it faster than at the place that we were at that time. One of the gaps that we identified quickly was, and it was really related to Aaron's family. He had a mother-in-law with a chronic disease and was having a hard time she was having a hard time getting approved for therapy. And so we connected just on some of the issues, how to get her approved. And we thought this shouldn't be that hard. And so one of the missions of FlexCare too, everything you said earlier is 100% on the dot. But one of the focus points for us was really to make sure that we are removing barriers to treatment, because that's what we were encountering so much. And so as we started FlexCare, the premise of how we built FlexCare was also to make sure we were treating our patients as our own family by removing barriers to treatment. So with that in mind, we started FlexCare, and in Oklahoma City, as you mentioned, Aaron lived in Dallas and I lived in Kansas City. And so we kind of tag teamed the Oklahoma City area, and I guess it worked out. So it's been fun.
Wonderful. Well, thank you. And that was a much clearer background about your goals and also the needs
Right.
for founding the company. And now, as you're looking back on that journey, could you talk for just a few minutes about what were some of the major challenges that you discovered you had to overcome to make that mission a reality and grow this company initially in bring in revenue and all the other things that founders are facing in their first few years? So, what did you face? What do you remember being the tough things you had to address? One or two, I'm sure there were lots. And what were some of the key lessons from that period of time, Callie?
Sure. One of the first difficult areas that we had to face was COVID. So we opened in 2019 and COVID was right around the corner. And it was at the same time that we had been approached by private equity to expand. And it was one of the hardest times. We had just gotten started. Our numbers were starting, our volume, our patient volume, our revenue was growing, and COVID hit, and then no one was referring patients, and patients weren't going to see their doctor. And it's in those moments, whether it's COVID or something that's unplanned, you realize that you have to find what makes you special, and you have to make sure that everybody knows why you're different than your competitors. And at that time, something that we had been told over and over again was you don't need to spend the additional money on private suites for your patients. Patients want to be in one big room for their infusions and talk. Luckily, my experience in home infusion and in infusion suites and pharmacies, we did that. And I saw mothers bringing in their kids, and there's another patient 2 feet away. It was just so it was not conducive to patient privacy, being comfortable. And so our first clinic, we spent a lot of money providing individual suites for patients, and lucky we did, because that was the one area that physicians felt comfortable sending to us, because we did have private rooms during COVID. And luckily, we went out and sold the fact that we have private rooms. We will see your patients. We can take them in through this outside door. We will basically do whatever you need us to do to get those patients seen comfortably. And like I said, COVID is the first example that was really difficult for us to overcome. But anything we had a lot of different scenarios I did operationally where there's not always a clear direction forward. And sometimes you just have to make the decision as you know it to be best. You may not have all the answers, but sometimes in markets very similar to ours, where it's a newer market, you are truly establishing best practices for everybody. So when there's a gray area, sometimes that is an opportunity for you to make the decisions and show everybody else how it should be done and how it can be done safely. And I think it was something for me personally that I felt was a big challenge. Again, COVID is the example I have in the back of my mind, but we had a lot of scenarios where you just don't know whether it's legally, contractually, what you can work with. And you, as an owner of the company, being responsible for patients and your staff, have the responsibility to make the best decision you can quickly and learn from it. Sometimes we're wrong. Sometimes they're wrong decisions, and that's okay. I think that would be my learnings. Luckily, we didn't make any big decisions that were wrong, I don't think. But that was one. And then the other challenge I would say was scaling. Healthcare is hard to scale, and we did end up partnering with private equity. That provided some financial limitations. It helped us as well, but it did provide some financial limitations for us. And so as we scaled, we had a lot of metrics to hit. And what I learned about scaling for myself and now for my team is that sometimes you have to force people into scaling. When you're a small company, everybody wants to own and have control of a situation because they know it best. And that might be true, but if you're going to scale and be the best, you have to teach other people the best ways and then have them also lose control of kind of what they're doing and give that to their team so they can scale the company even further. So it was really hard for me to personally to give up control of those situations. And I was able to. I built a really good team underneath of me. So that's obviously very important to be able to do that. But I would say scaling in healthcare in general is very difficult. So I think sometimes having, I don't want to say overloading someone's plate with something just so they have to give something up. But that's kind of what we did. And at the time, it didn't feel good, but it was the right thing to do. And I think they realized, okay, I've got more important things to worry about. I can't give this up. It's a weird, I think, control thing, especially as a small company that I dealt with, the people below me dealt with, and I think the people below them are dealing with now. So those would probably be the two things that were challenges for us that we overcame that helped us get to where we are today.
Thank you. And I really appreciate your mentioning the challenges in terms of thinking ahead to scaling. I will also say, Callie, that in addition to what you mentioned, I heard about 5 lessons learned there, and I'm sure that there are dozens of lessons learned. Uh, and this was your first experience as a co-founder. Is that true, or had you started other companies before this?
This was my first, correct.
Wow. So again, super congratulations because uh, just 3 things you said that I'll highlight before we move on to the growth stage of FlexCare. It really knowing what your mission is and what your competitive advantage is going into the market is so important. And that is something that you and Aaron had nailed with this decision that was possibly counterintuitive with private suites and comfort. And that was all part of treating your patients like family, wanting to make this experience, which is a hard one, to be as comfortable and convenient and accessible as possible. And I loved hearing how that paid off when that was your massive competitive differentiation that made doctors more comfortable referring patients and patients more comfortable coming to your center because you had this private accommodation when it was the essential thing. And also just jumping into the leadership through also modeling for your team members that you can't control everything. And that if you want to scale a company, delegation and best practices has to rule. And I know from your operational experience, that was a big factor in modeling operational best practices. However, it's not easy to jump in and make a decision in a gray area and knowing that you wanted to do everything right for your patients and for the complicated procedures. And that's another like key lesson that you have to jump in and make those decisions as an entrepreneur. So thank you for highlighting those things.
Sure.
And now I'll switch gears to that growth story because this was the foundation and the hard parts, and it's always challenging. So we're going to be aware of that. And I also love what you said that it's extremely hard to scale in healthcare, and a lot of healthcare startups don't manage that transition that you and Aaron and managed for FlexCare infusion centers. So now I'm going to ask how you did it, like on the revenue and scalability and operational side. I know factually because the story's in the book that you opened up more and more centers. You geographically expanded. Occasionally, you acquired other centers. And behind the scenes, however, you had to be solving those scalability challenges. So tell me in your own words, if you would, how you scaled, how and when you knew this kind of growth might be a possibility to start.
Right. So how we scaled was really with the support of investing in technology. We could not have scaled like we did without technology helping us. But the really interesting thing is that Aaron, with his background in technology and my background really teaching technology in the home infusion world. And so being comfortable with that and operationally kind of guiding some of those programs in the past in healthcare really helped us to, we work together so well. And so it was really easy for us to build and understand what we needed to build to process patients faster, more effectively. And that allowed us to reduce the amount of people involved. It allowed us to get patient volume faster, or patients scheduled faster, processed faster, in the chair faster. And that volume itself led to, and with the expansion that you mentioned out of state or acquiring into new states, that volume allowed payers and our providers to recognize us as a national platform, which in itself allowed us to do what we did, because we rely so much on payer contracts. And when a payer recognizes your growth, recognizing your volume, so not just patient volume and patient capture, but also how many locations do you have nationally, they also want to save time. They don't want to work, I guess, more than they need to either. So they give you national contracts, which becomes easier to scale. Same with pharma companies. They recognize you as a national player. It becomes easier for you. So just by nature of expansion, getting that volume, even though it was, I mean, there's always these really like high increases of patient volume that are hard to scale, but you get there, and it ends up with a technology supporting it. And really, I don't want to discount either the team that we had. We have really just built an amazing team, and culturally, I think we all were just so motivated to build something amazing, and that helps, right? You have the technology, you've got the growth for like your customers, the payer side, the pharma side, to help kind of catapult you, but your team really carries you as well. And I would say that if we did not have the team we did, and that's Aaron, myself, really everybody on our team, we would not have been in the position we are now, in my opinion.
That's wonderful. And thank you, because you definitely hit on so many of the important factors: the national, the technology, the culture, and the team, and being able to pull it all together and deliver and get
Right.
the people you started to serve, get their treatment, get them in the chair and as quickly and as efficiently as possible. That was what they wanted too. So you
Yeah.
were delivering on all fronts in that scalability. So now looking at this year and the year ahead, congratulations. So a happy exit, I hope for you, but not an exit, because with the acquisition by Optum as a major national provider, FlexCare Infusion is going forward with its mission, and you are the CEO. So, congratulations on the acquisition and on your
Thank you.
role as CEO. And so, I'd love to just hear your thoughts now, Callie, about what's ahead. What are
Sure.
you looking forward to in the year ahead in terms of FlexCare and the business growth, and how you're going to have more impact and do more for patients? And if you would like to share, what are some of your professional and personal goals for growth in the year ahead?
Sure. So, from a business perspective, FlexCare's goal has always been to be a national provider, and it's really cool to be able to say that we will be with Optum, and that they will allow us to be more of that. And so, this upcoming year in 2026, our plan is to really build density in the states that we're currently in, and then really identify our core targets for 2027 for out-of-state expansion. So, really building density in this next year is super important for us. 2027 is going to be all about out of state expansion. And the really cool thing, really, that Aaron and I even worked on prior to starting FlexCare, is something that I'm starting to do a little bit of now with Optum, which is really creating and participating in site of care optionality for patients. Now we have home infusion line of service. We have an AIC, so ambulatory infusion centers, and an AIS, which is a pharmacy-based clinic. we have options, and we have more options to provide patients. And looking forward to really exposing our team to what that's like. I had 10 years of it before starting FlexCare. They haven't had any of that. And on the pharmacy side, on the Optum side. And now that we have a partnership with Optum, I think it's just so cool to be able to say the team that we started with, 7 years ago, we can elevate them and escalate them into just a different service line that they may not know existed, and have them become kind of experts in that field as well. So I'm actually most excited from a business perspective about the options for my team, because I speak about my team a lot, but I really love my team. I can't say that enough. And so for this next year, my goal would be to ensure that they are placed well in the company and that they are the ones building out FlexCare, because I have full trust in what that will look like if they're leading the way. And personally, I mentioned a little bit about the site of care optionality, which is kind of the core of what I love doing from a nursing perspective. But I also want to take a little bit of a step back again and let my team kind of go with it and lead FlexCare. And as I learn something new within Optum, and learn what else is kind of what are next steps from Optum's perspective for the next 2 years that I don't know yet. So there's still a lot to learn since we just closed with the acquisition, but I'm super excited. The Optum team they're great to work with, and I think they'll be great partners. So looking forward to honestly what's to come that I don't know yet. So it's all very exciting.
Thank you on all of that. And I'm going to wrap up. I wish that we had more time, because there's so much more I'd like to know about this incredible journey and the success you've had with it, and also everything you've learned from it. So I always like to wrap up by asking the 100X entrepreneurs that we are privileged to interview and write about, what advice would you have for aspiring entrepreneurs? I teach entrepreneurship. My co-author, David Reske, teaches business planning at Boston College. So we know a lot of students who want to be entrepreneurs. We work with small business owners who would just love to grow at 100X pace. And you shared some of those important challenges and lessons, Callie. And now I hope also in this case, I don't get to talk to too many healthcare professionals who have that long experience as a nurse in particular. So, maybe put a little bit of your advice in the context of people who are in a profession and now want to become a founder and an entrepreneur, but no limits. What kind of advice would you give to other entrepreneurs who hope to grow at 100X?
I would say you need to have the right business partner. If you do have a business partner, it makes all the difference having that really good, solid relationship. If you are the only founder, I would say understand your weaknesses and build your team around them. Build your team around your weaknesses. We all have them, and that's okay. And you need support in those areas. I would also say get comfortable with taking calculated risks all the time. As a small company starting out, it is all about managing risks and understanding which ones you can take, shouldn't take, maybe shouldn't, but may take. And understanding that impact, I think, is super important. The next one would be to take care of your team, because if you want to build a culture and a team that is stable, that can support you through the hard times and kind of the years of kind of painful growth that sometimes happens in companies, you have to make it an enjoyable and meaningful place for them to work. And I think that is something that is undervalued and not spoken about enough.
Wonderful. And again, Callie Turk, co-founder and CEO of FlexCare Infusion Centers, now a division of Optum, and looking forward to more growth, to building her team and giving them more opportunities, and not surprisingly, Callie, from everything else you've said, learning what you don't know yet. I love hearing that that's one of your goals for the coming year. So wishing you every success, continued growth, continued learning, and fulfilling the mission that you've started out to accomplish. Congratulations, and my thanks for taking the time to talk with me, with everyone interested in the 100X entrepreneur journey and experience. So
I appreciate
it.
Thank you very much.